My name is Camila Sandoval. I am 27 years old. I am a nurse and I studied at the Catholic University of Mo. I did my first practice in Talca, specifically in CESFAN Magisterium. I was in my second year of study, but I did the professional practice at the hospital of Talca. Well, you have to learn a bit of everything, but I spent a lot of time in the intensive care unit. Uh, I didn't work there because there was no place, but after a while they called me from CESFAN de las Americas, where I worked for 2 years. I worked 6 days a week. In the morning shift from 8:30 a.m. to 5 p.m. Yes, I comply with all the rules or norms that were taught to me. However, not all, not all of them were explained, so I had to look to the side to learn. Obey the person in charge of the Shifty College. Many of them did not comply with the regulation, but they did with the discipline sides. It's sometimes more internal. I never broke an instrument, but I did lose a thermometer. I told my supervisor about it, and she told me to not worry, and she took care of it. Therefore, I didn't have to pay for anything. First, I must wash hands. No. First, I must wash my hands and arms. Then introduce myself and, and explain to the patient what would be done either for diagnosis or exams. They are informed about things that they can or cannot do and if their procedure is required. Vital signs are taken where blood pressure, weight, height, and body temperature enter. Finally, the patient enters to the general medical rooms where a nurse injects him into the gluteus if it is necessary or left with the doctor prescription. In general, it was good because I never had problem with my college or a patient. Although in the beginning it was difficult for me to learn the other room or watch objects. On the other hand, it changed my way of thinking and seeing life. Because when you take care of a sick person, you not only deal with their illness but also how they feel. There are small things in which I have been able to help my family, friends, or myself, giving data on how the body works, on why some pain occurs. Rather clarifying doubts. On the other hand, I have participated into rural activities and giving support when it's required in the health year. Well, since I was a child, every time that I went to health centers, the medical instrument and the nurses clothed and the closer knowledge caught my attention. Especially that they help people and I didn't have interest in another profession either.